here at your ankle. Go ahead and lift. Yes. All right, are you comfortable?
Yeah.
Okay. If you feel like you need extra, like if you have a plethora of pillows, you can stick them like against her belly. You could stick them like behind the legs. Like you could just stuff pillows wherever you would like to make sure that she's totally supported and able to really rest her body weight. But if you only have a few, you would need at least 3. But I highly recommend just getting a body pillow.
And the 3 you need are head, ankles, knees.
Head, well, I guess that would be 4 pillows.
Body pillow?
Yeah.
Okay.
Because you would need a head pillow, a hugging pillow, knees and ankles pillow.
Okay.
Sometimes if the knees and ankles pillow is long enough,
Could do both.
then it can just be 1 pillow. But if you
Gotcha.
only have like the little like hospital pillows, those ones are pretty small and flat, so you may need a lot more of them. You can also creatively use bolsters if you need them. You can use rolled up sheets and rolled up towels if you need them. Just any little bit of cushioning that you can use to support her body.
Cool.
So the most challenging part of side lying is nailing the draping. And once you have the technique down, then it's really no problem. But getting to that point kind of can make people a little bit nervous. So what we're going to do is we are going to fashion Lizzie a lovely pair of pants out of the sheet. So kind of like before, how we did it before, taking it up to the level of the knee. All right. So we've got nice little shorts. Now to make this more modest and secure, and to make it so that if we were going to do some range of motion work, she would be totally covered all the way around, we're going to take both sides of the sheet and wrap it around her leg. So we're going to take one corner under, and we're going to grab the other corner and pull that under. So now we have a little loop of sheet with 2 ends, right? So I can use these ends to tighten the sheet, and then I can loosen the sheet like this, right? So make sure you keep track of your ends. Once we have it wrapped around her leg, we can scooch it upward and make little pants. And you can pull it up just to the hip or all the way up, getting some of this bulk out of the way. And I asked Lizzie's permission if it was okay if I showed her underwear. Where's my other end? Here it is. All right, so I'm going to keep that nice and tight. But you can pull it up. You can reveal the entire glute if you want to. It just depends on how you manipulate that sheet. You just want to make sure that gluteal cleft is covered, the sheet is secure around the leg, and you can always re-secure the sheet with your little ends, right? Does that make sense?
Mm-hmm.
Do you guys need to see it again? No? Okay. All right. So for undraping the back, sometimes it can be a little bit challenging to keep the drape in place. There's a couple tricks that you can use. I like to go ahead and pull your arm out for me. I'm going to have you pin the sheet down
Oh, I see.
with your arm. There you go. That's a great way to do it so that you don't have to worry about exposing her chest, and it keeps her warm. If she was asleep, you could always just like tuck around if she wasn't awake enough to move her arm for me. You can also, if you have a blanket, you can use that to hold the sheet up. But I use usually some clever tucking. So when I undrape the back, I will usually do a tuck at the hip. Sometimes with permission, I will tuck into their underwear. You can also use a clip too if you really want to keep it secured. There we go. So you want to make sure that you have all the way down to the sacrum revealed in the back. If you have so many pillows on the table that you feel like you don't have enough sheet, you can always grab another sheet just for wider coverage, especially if you work somewhere that has like criminally narrow sheets. These ones are nice and wide, but sometimes you will end up with like my flannel sheets that I have are really narrow for this, so sometimes I need to get an extra sheet if I really want good coverage with a lot of pillows underneath. All right, so when you are doing side laying massage, now I have a nice electric table, so I can move this up as much as I want, so I don't even have to bend over to work on her back. I can get in here and do all the petrissage and compression work and Swedish that I want to.
So when you're doing that Swedish, would you have to do the strokes this way or this way?
So I usually, you can do either one. What I usually do is I will do half the back or a little bit more than half the back and then flip them over and then do the other half. So when you have somebody side lying, it's really easy to just do like the top half and then the bottom half, but you can work in any direction. So if I didn't have an electric table and I couldn't put this up to a ridiculously high height, I would have to be much more careful about lunging into my work and making sure that I'm not hunching over.
Right.
We want to make sure that you keep your spine straight so that you've got that nice, consistent, firm pressure that you can use. If you want, like say you don't want the direction of your pressure to be coming down at an angle like this, and you want it to be more straight across, that's an instance that I will sit for. Lots of times when I'm working on the erectors or when I want to get into the multifides and rotatories, I will sit to get into that just so that I can, my direction of pressure is directly, straight toward her spine and not at an angle. You want to be careful too that when you are applying pressure that you're not shoving your client over or wobbling them too much. If you feel like you need to get deeper pressure without pushing on them, you can always support their torso with your arm, or you can support their hip with your hand. Just make sure that you're not just slowly rolling them off of the table. So you can see that we have fantastic access to the entire back. This is a fantastic opportunity to do a ton of work all around the hip. You have complete access to hip and glutes in this position. The one challenging part that I find when I'm working on somebody's side lying is doing really effective neck work, because I'm not so much using the weight of their head to get the job done like I would be if they were supine.
Right.
So when I'm doing neck work, it's going to take a little bit more hand strength. And again, lots of times I will do this sitting. But you can work on, you know, like the scalenes using the weight of their head, but you would only be able to do that on one side at a time. Getting into the occipitals is a little bit more challenging. Do you have any special tricks that you like to do for that, Zephyr?
I don't know if I think of them as tricks. I guess don't be afraid to try different angles, and don't be afraid to sit down.
Mm-hmm.
So, like, if you come from this side, may I?
Yeah.
You can even come across here to really just like relax and pull
Mm-hmm.
and get into the suboccipitals. And if they're okay with you touching their hair, really take that all the way into the scalp. Yeah, people love the scalp work.
That sounds really nice, yeah.
And if you happen to, you know, slip in a nice scalp massage in there, nobody's going to complain about that.
And we'll show you more days of side lying, like myofascial release and such, but we did a little of this before, like this arm is wide open too, so don't think that you need to come just from this angle. You can really lift and pull and support to get in the arm as well, yes.
Is myofascial release, and I saw the other modalities, are they a contraindication?
So we're concerned about the relaxin, particularly with focused work in areas where the ligaments are not as secure, but we can still do some general MFR, like in the back and so forth.
Okay.
Yeah.
Okay. Thank you.
If they were going to, like, if they're having trouble with feeling like their knees or hips are getting a little bit loose, I know some women will have just like spontaneous dislocations of the hip, or their knees will kind of shift around. If that was the case, then you wouldn't want to do MFR like across that joint. You want to make sure that that joint is staying as strong as possible and you're not lengthening it and really loosening it. So that would be the precaution there. If you were going to do myofascial release like on the back, that would be okay. But I would just be really careful about doing it across joints, or like Zephyr said, around the ligaments. So I usually, when I'm working in the hip and glutes, I almost always work through the drape, and that works really well for me for pregnancy massage, because then I can really get a grip here. But you don't have to do that. You can undrape it completely and work, you know, like from the waist all the way to the foot, just as one unit. You don't have to, you know, break it up into sections quite as much as you do when you're doing other draping. One beautiful thing about side lying is how much access you have all the way around the leg. You can really pick up their limb and move it. You have access to, you know, the hamstrings and the quads and the feet. So if we were using regular pillows, I might actually be able to access both of her feet at the same time and work them while she's lying, like on her left side, where it's safer for her to lay on that side for a little bit longer. And like I said, earlier, if they have swelling in their feet, or just fatigue from, that extra weight, any type of foot massage feels really good. And then when we get into lymphatic drainage, you have the opportunity to perform lymphatic drainage up the entire leg. So with lymphatic drainage, you're going to start toward the top of the leg and the hip and clear this area. You kind of work like this. So you can see that if you were going to address someone's edema side lying, you have plenty of access to do a really nice clearing of the lymph. You can, depending on your pillow situation, you can have them like raise their knee so that you can access the leg on the bottom. I don't tend to do that quite as often unless I'm really pressed for time. I like to do, the top side really thoroughly and then flip them over and do the bottom side. If I'm going to be doing the neck, the exception to that is that the best pressure that I can get is on the side closest to the table. So it's kind of like, like the whole right side, but then the left side neck is going to get a little bit more attention in this position, and then it'll be the opposite when I flip her over. Does that make sense?
Yes.
Okay. Any questions?
Sue.
Yeah.
Since, cause analytics, do you, whenever you're flipping somebody who is pregnant, do you like take the pillows and then have them roll over? Do they get off the table and get back on the table?
You will disassemble this entire nest that you have built and then reassemble it once they have flipped over. I have had a couple people who just wanted to get off the table and then come around and get back on the table, but most of the people that I've had are fine to flip over. Sometimes they need a little help, like an arm to hold on to, so that they can get the leverage, especially later in pregnancy, to heave themselves over. And sometimes if you're having that like low back pain and sciatica, it can be more challenging. That's why I like to have 90 minutes so that nobody's in a rush to try to, flip like a pancake when they're hurting.
If someone wanted to get off and get back on the table, would you need to leave the room?
I've done it. I've done it where I've left the room and come back, and I've also done it where I've just turned my back like to a corner of the room and let them get situated and let me know
Sure.
when they were under the sheets again.
Okay.
It just kind of depends on, what your room situation is like, and if you think that they might need some help, that can be handy too. Yeah.
I have a draping technique I'll show you that I like to use for hot stone massage as well, where you use an extra flat sheet on the bottom, and then you can wrap them up in it and help them sit up so that they're totally modest, and that's nice too.
Yeah. Jordan?
If they need help, how do you just like hold an arm out and look away?
Yeah. When you're in a room with just the two of you, it's much easier to be able to like tent the sheet up much higher than we would here with an audience, so that I can, hold the sheet up and give my arm and not, like I'm creating my own barrier, or I can just turn my head.
Okay.
I have noticed that most pregnant women have had so many invasive doctor's appointments that at that point they don't care what part of their body they show you, and they will just boobs flubing everywhere. So just be prepared for that. Kind of like old ladies will just like whip their clothes off. Pregnant women just don't give a shit anymore. So we talked about low back pain and sciatica, and this is a great opportunity to really get into the hip rotators, to get into piriformis and address that with, you know, a lot more of your own like body weight. It's almost effortless. You can get in there with your forearm, you can get in there with fists if you want to. So when you guys are practicing this, just start to kind of feel out what positions are the most comfortable for you. You have the whole IT band here.
And we'll do side lying again tomorrow since we had to do so much introduction today, so you can have a longer lab tomorrow.
So I think that's about it. Unless you guys want to demonstrate me flipping her over, but you do.
And also, if it's not too much, if I could, like, once she has her clothes back on, could I see the pillow placage again?
Yeah, yeah. All right. So when you are going to flip them over, I usually leave the head pillow in one spot, just because that's easy enough to roll over on, just like you do in bed. So I will go ahead. I'm going to pull this out from your ankle. All right. Pull this out of your knees. All right, you want to hand me the huggy pillow?
Most people love the nesting position, and if you get them pillowed up well, you're going to have some deeply, deeply relaxed people, like falling asleep.
Is there any other time besides working on pregnant women that people request a sideline position?
You know,
Like
I don't
older
see-
people or like
I don't see people request it a lot, but it's fantastic in a lot of situations. You know, like Elizabeth keeps talking about the hips. I mean, I think it's especially effective for the hips and the shoulder and any sideline issues. So, yeah.
Like when we get into MFR, we're going to do the entire lateral line MFR. I also find it to be helpful as an option for older people or people with vertigo. Sometimes laying flat on your back can trigger vertigo and make you really dizzy. It's very unpleasant. So if that's the case, either the semi-reclined works well, and sometimes they'll be okay just side lying, that it doesn't trigger that quite as much.
Some people's low back pain issues are also triggered more face up, face down,
Yeah.
and this position doesn't usually bother them.
All right. You ready to flip?
Sure.
So, I'm going to pull your arm in. And I usually put my hip up against the table so they know where the edge is. And then make sure to even your sheet out, because it's really easy to short sheet yourself. And if also, I forgot to mention, when you have someone side lying, if you feel like you're having to lean too far in, you can always ask them to scooch back a little bit toward the edge of the table, just as long as you let them know where the edge is. You can have them scooch around to make it a little bit easier for you to get to everything without, you know, having to bend over as much.
Would it be more secure feeling if she had the hugging pillow above the sheet? Would that trap the sheet better?
I mean, I suppose you could do that, but that would require them to have their arm out, where you kind of have the option to keep them totally warm under the covers. Yeah, you could do it that way. You could also bring in, if you have it, an extra pillow to put on the outside of the sheet to hold that too, if you wanted to, just depending on how many pillows you have at your disposal. All right.
have another question.
Yeah.
If you were like actually about to massage a client who was pregnant and maybe the table height wasn't as tall as you would like and you didn't have an electric table, would you actually squat the whole session or, you know, in the position, or would you actually make them get off so that you could adjust the table height?
I personally would suffer through it
Yep.
and then just remember for next time.
Mm-hmm.
I have left like a sticky note for myself in somebody's chart to remind me that I need to change the table height for them. Whether it's side lying or some other issue, like I've had, you know, big barrel chested dudes that I've needed to really lower the table for.
You
So-
could also sit for a lot of it.
Yeah.
When I went to massage school 30 years ago, we had a strangely tough mentality that you had to stand for everything. And over the years, I've been impressed when students need to sit a lot, how many areas of the body that you can actually treat effectively while sitting. So if they were just really at the grossly incorrect height for you, they might be at the right height for you to be sitting down. And my knees actually feel fine when I kneel as well, so sometimes I'll just kneel to get to the right height. But a lot of people obviously don't like that for their knees, so you could sit.
Yeah, and that also, if you have proficiency with both standing and sitting, if you have an instance where, you know, like you've sprained your ankle, you may not have to cancel all of your clients. You may just have to like modify how you're actually performing the massage. One of my coworkers tore his Achilles tendon, and he would have been out of work the entire time if he hadn't been able to adapt to doing a lot of his massage sitting. And then when he was able to stand, just standing on one leg or supported with the stool, so that he could continue working instead of having to take months off.
Not laughing at you there,
Jordan.
Can we one day, or do you have resources on what some good like adaptive measures may be in case that comes up in our future?
For
Like, if I hurt my Achilles tendon and needed to do everything sitting for several months, like
there aren't any that I particularly know of, but I'm sure it exists.
okay.
Yeah,
We could do some labs with different positions though.
yeah.
I just think it might be a good idea. Like, I don't know. I skate and I'm probably gonna hurt something at some point and would like to know how to continue working while I'm injured.
Yeah, yeah, and it inevitably at some point you will have an injury that you are dealing with, that you will have to adapt at least a little bit for. For myself, it tends to be low back pain. Luckily, when I did sprain my ankle on my first day of roller derby class, it wasn't very severe, and I was able to work just fine with a ace bandage. But I also know that I have enough proficiency with sitting that I could have gotten most of my massage done that way too. All right, Lizzie, here comes the pillow for between your knees. Go. All right, here is the ankle pillow.
Yeah, there's actually not much room left. There you go.
We'll just talk about it right there. All right, so you guys have the basic idea? Okay, let's